Hi everyone, I am Dr. Himadri. Let's talk about neonatal resuscitation. Question is, why should you know neonatal resuscitation? Because all the neonates are not supposed to have the respiration or the cry on its own. Therefore, they need some sorts of support to initiate this respiration and to maintain it. Therefore, we need to give neonatal resuscitation. Remember, out of 100%, only 10% neonate requires neonatal resuscitation, and out of this 10%, only 1% requires extensive neonatal resuscitation, that is in the form of intubation. And why should you do all these things? Is to prevent birth asphyxia and birth asphyxia related complications like cerebral palsy. So the preparation of birth starts even before the birth of this baby. There are 4 questions you are supposed to ask here. That is, what is the expected gestational age of this pregnancy, and also is the amniotic fluid clear or not, and any perinatal risk factor like antenatal or interpartum risk factors like maybe IUGR, polyhydramnios, maybe oligohydramnios, or ask for meconium stent liquor and all that. And also in the 4th question, the umbilical cord management, it should be asked or discussed with the obstetrician and the mother, and also in case of LSCS, discuss with the anesthetist. Okay. And also remember this, in the preparatory phase of this birth you need NRP trained doctor. I know that you are already going to be NRP trained, and also if any risk factor is present, at least 2 doctors are mandatory for this neonatal resuscitation program. Okay. And the first step is hand washing. Do proper hand washing for 1 minute and wear the sterile gloves, and followed by equipment check. This is very important because we know that at the time of work most of the equipments may not work properly. So the back mask checking, blade and light checking, and ET, that is your endotracheal tube size checking, these are very important before even the birth of this baby. So this is the preparatory phase of this of birth, that is the preparation for birth. Now the real thing happens, the birth of this baby. And after birth, the first thing is to note down the time of birth. Okay. And after that, place the baby on the mother's abdomen. So after birth you have to note the time, and you need to tell it clear and loud what is the time. Place the baby on the mother's abdomen and dry the baby with dry and warm linen, okay, or the dry or warm cloth. And after that, assess 2 things: what is the breathing, and the baby is breathing or not, the breathing pattern, and also the crying is present or not. There may be, the answer could be no, that is the baby is not breathing or not crying, or could be the answer the baby is breathing normally and also there is cry. So there are 2 situations which is possible, and we will be dealing with the better situation, that is the baby is crying and also the breathing is normal. Okay, the breathing is initiated. So what should you do in this case? There will be routine care of this baby. In the routine care, dry with dry and warm cloth, because this is important for prevention of hypothermia of this baby. Okay. And after that, put the baby on the mother's abdomen as I have drawn the picture here, and therefore there is skin to skin contact which is initiated just after the birth. And if needed, if there is a lot of secretions present in the mouth and the nose, you need to clear this secretion by doing suctioning. So the suctioning is required. And after that, if there is any secretion, and after that there is remember one thing, delayed cord clamping. Look at the picture, and this cord clamping should be delayed for at least 1 minute, and it should be done between 1 to 3 minutes, because it will give more amount of the blood to the baby. Therefore it will prevent the anemia and also prevent BPD and all that. Okay. And keep the baby prone on the mother's chest and abdomen. Cover the baby with warm cloth, and baby and mother both with a blanket. So it will do what? It will prevent the hypothermia. And initiate breastfeeding as soon as possible. And the skin to skin contact STS should be continued for at least 1 hour. And now assess the baby for breathing and also the color. Okay. So this is the routine care if the baby is crying and also having normal breathing pattern. Okay. Now we will deal with comparatively difficult situation where the baby is not crying and also the breathing is not being initiated. So what you have to do? You need to start initial steps of resuscitation. In the initial steps, the first step is cut the umbilical cord immediately and send the baby to the radiant warmer, where the baby will be given the radiant warmer, it will prevent the hypothermia. The second step is dry the baby with dry and warm linen or cloth. And third step is to stimulate the baby. Just hold the baby, that is give a gentle rub at the back of the baby. Hold the baby this way, that is in the prone position, and also give a gentle rub at the back. Remember, no flickering and no slapping at the sole is now recommended. That is, flickering and slapping should not be done at the sole. After that, position the baby. Once this gentle rub is given, you have to position the baby in a supine position, and also the head should be in such a way that there will be sniffing of a morning air, that is slightly extended head. And if there is secretion in the nose and the mouth, you have to clear this secretion with your suction machine. Remember one mnemonic here: M followed by N, that is mouth followed by nose. In mouth you can go up to 5 cm, in nose up to 2 cm, and the pressure should be between 80 to 100 mm of Hg. And after doing all these 5 steps as initial steps of resuscitation, you have to assess the baby. And what will be the parameters? Number 1, respiration, and number 2 is the heart rate. How do you monitor the heart rate? Keep the stethoscope in the heart, that is over here, and also count the heart rate for 6 seconds and multiply it by 10. As for example 8, suppose the reading is 8, and also multiply it by 10, becomes 80 beats per minute. Okay, so now imagine there could be few situations according to your assessment after doing these initial steps. That is, the baby could be well, that is breathing well, and the heart rate is more than 100, and also there is no cyanosis in this situation. So therefore you have given the initial steps of resuscitation very well. You need to give observational care. And there could be another situation where there is no breathing or the gasping respiration, and with heart rate is less than 100 beats per minute. This is the situation you need to give positive pressure ventilation. So remember this thing. You have one better scenario where the observational care is recommended, and another scenario where the baby is not basically taken any proper breath, that is there is gasping respiration with heart rate is less than 100. You need to give positive pressure ventilation. So in case of observational care, that is the better situation, you have to do one thing, that is give the baby back to the mother. That is the number 1 thing. Number 2 is continue this STS, skin to skin contact, for at least 1 hour, and initiate breastfeeding as soon as possible. And there are 4 parameters that should be monitored. Number 1 is temperature, number 2 is heart rate, and breathing and color of this baby. So it should be monitored every 15 minutes for the first 1 hour, followed by every 30 minutes in the next 1 hour. So these 2 hours monitoring in the observational care is recommended in NRP, Neonatal Resuscitation Protocol or Neonatal Resuscitation Program. Okay, so now let's talk about the positive pressure ventilation, that is PPV, positive pressure ventilation. So the baby is not taken any breath, there is gasping respiration, as well as the heart rate is less than 100. So what you have to do in this scenario, attach the SpO2 probe. And where you will be attaching it? In the right hand. Remember, in the right hand or in the right palm you have to attach, and this is called as pre-ductal measurement of SpO2. So this is the picture of your bag and mask. Bag and mask is required for giving PPV, positive pressure ventilation. Okay. So, and also this is the self-inflating bag made up of silicone. That is self-inflating bag, having this the volume is around 240 to 500 ml. Remember, we usually use 500 ml, and this is made up of silicone rubber. There are 3 valves in the outlet section, which is called as valve assembly or the outlet valve assembly, and there is 1 inlet valve. You can see the image. There is 1 inlet valve, that is air will enter into it via inlet valve, and in via 3 valve assembly it will go towards the baby. Okay, there is one additional valve which is called as PEEP valve, that is positive end expiratory pressure, which could be given. These are little modern things. So remember another thing, that shape of the mask should be either round or it could be anatomical. The size are usually 2, 0 or 1. 0 for preterm baby or 1, and 1 for your term baby. Okay, so these are basic things about your bag and mask which you need to know. So now look here. There are these 3 outlet valve assembly. This is important. Number 1 is your pressure release valve, which is like your pressure cooker valve. If there is more than certain pressure, it will be activated, okay, to prevent any damage to the lungs of this baby. Here the cutoff is more than 40 centimeter of water. If the pressure is more than that, it will be activated and it will release the pressure. Number 2 is your fish mouth valve. Fish mouth valve is for entry of this air into the baby's mouth. Okay, and this black color is your expiratory valve. Whatever air is that will come via expiration, it will go by this side and it will go out. Okay, so this 3 outlet valve assembly is very important, along with 1 inlet valve. Total 4 valve. In case of advanced devices, there are total 5 valves, additional PEEP valve. Okay, so before you start giving PEEP, that is positive, before you start giving this positive pressure ventilation, you must know these basic steps of this device, bag and mask. Okay, so now the steps of positive pressure ventilation. Number 1 is selection of mask. You must select appropriate sized and shaped mask. Okay, number 2 is clear the airway. Once again the same mnemonic, M followed by N, that is mouth followed by nose if there is any secretion. And also position the head in the sniffing of a morning air, that is slightly extended, like that. You just slightly extended, not very much. And as a doctor, you must go at the head end of this bed. Okay, so you go to the head end of this bed, that is cot we call it. And also the position the mask like a C. Look here, it's like a C. You have to apply like this. Okay, so it will be like C. And how much breath you should be giving by this bag and mask? 40 to 60 breaths per minute. Remember one thing, it's like breath 2 3. When you are telling breath, you have to squeeze during breath and you have to release during 2 3. And this is a arithmetic thing that we have to use to accommodate this within this time period. Okay, so breath 2 3, breath 2 3, squeeze during breath and release during 2 3. Okay, and it will be around 60 breaths per minute. For more than 35 weaker children, you have to give the room air 21%, and for less than 35 weaker, remember 21 to 30% of FiO2, that is oxygen, should be given. What we do? We add this oxygen via oxygen provider. It is 100%, and another is coming from the room, and which is around 21%. 100% mixing with the 21, around 40%. This is for your preterm, that is less than 35 weaker baby. Okay, so this is important. How will you give this breath? So this is very easy, like breath 2 3, breath 2 3, squeeze and release, breath 2 3, breath 2 3, breath 2 3, like that. Okay, how much for how long it will be continued? It will be continued for 15 seconds. And you have another doctor, and he will be or she will be monitoring 2 parameters here. One is heart rate, that is this technique, just apply the stetho here and here the heartbeat. Okay, and look for the chest movement. So if the heart rate is increasing and the chest wall is moving, that means you are doing it very right. You have to, after continuing for 15 seconds, continue the same thing for another 15 seconds. Suppose in assessment part, if the heart rate is low and the chest is not moving, okay, now you have to go for steps to improve the ventilation. So this is remembered as MR SOPA. Okay, now this becomes totally standardized. MR SOPA. M means mask readjustment. So what happened? You have to open it and also readjust this mask. So mask adjustment, and also position the head. So slightly extended head and with like that C position. Okay, sniffing of a morning air position, like the slight extension of this head, and also apply the mask. You have to continue 5 breaths. Breath 2 3, breath 2 3, like that 5 breaths. If in this five breaths you can see the SpO2 is rising, heart rate is increasing, you have to continue for 30 seconds. If the chest is not moving and heart rate is not rising, you need to go for the second corrective steps like S and O. M are so, and that is suction, M followed by N, and O for open the mouth, and also just open the mouth with a finger and also start ventilating like that. Okay, so you are in these steps, just continue for five breaths. If it is okay, just continue for 30 seconds. If after giving 5 breaths still not working, you have to go for the next step, that is PA, SOPA, SOPA. Now PA means increase the pressure, and A means alternate area, that is you need to intubate this baby. Okay, so remember, M are SOPA, M are SO, and PA. And after these things, once again you need to assess this baby. And what are the parameters? So remember, as we are doing this neonatal resuscitation, heart rate could be less than 60, or heart rate could be between 60 to 100, or heart rate could be more than 100. If the heart rate is more than 100 and also spontaneous breathing has been started, what we will be doing? We will be continuing this positive pressure ventilation for 2 to 3 minutes, and gradually we will taper it off. This is our rule, this is our protocol. Okay, and also if the heart rate is between 60 to 100, we will be intubating this baby. Suppose at this step, if heart rate is less than 60, you have to intubate and also start giving chest compression. So what is happening here? Even after 30 seconds of positive pressure ventilation, you have given initial steps, not responding, positive pressure ventilation. After 30 seconds of positive pressure ventilation, the heart rate is still less than 60 beats per minute, becomes an indication for intubating and starting chest compression. Okay. So in case of chest compression, the FiO2 is mandatory 100%. You need to give 100% FiO2. This is mandatory, and give the just arbitrary. There are two nipple lines, just arbitrary nipple lines just below of it. That is lower 1/3 portion of the sternum is the portion where you will be giving this chest compression, and this chest compression will be of 2-thumb technique. Okay, that is you just place your 2 thumbs like that this way and also start giving. Okay, you will be in the head end of this baby, and remember 1/3 portion of the anterior chest wall must go down, and this is the minimum. Okay, so this 1/3 portion of the chest wall will go downwards, and your chest compression should be given 90 chest compressions per minute. The ratio is like chest compression is to ventilation ratio is 3:1. Now how you will do it? Just one. This is done by another rhythm. Just 1 and 2 and 3 and breathe. During one chest compression, during 2 second chest compression, like 1 and 2 and 3 and breath, give breath. So this 1 and 2 and 3 and breath, this whole things is done. Usually it takes around 2 seconds. Okay, so these 2 second things, that is this things should be continued for at least 60 seconds, that is 1 minute. So if you follow this, that is 1 and 2 and 3 and breath, it will be very easy for you to continue this resuscitation for 1 minute. Okay, so at this step you must remember, just have this mnemonic in mind. Cardio means you are giving chest compression with positive pressure ventilation, and A means airway is secured with an ET tube, that is endotracheal tube, and R for this rate and rhythm is appropriate, that is chest compression is to ventilation 3:1, and depth is at least 1/3 of your anterior posterior chest wall, and also IO means inspired oxygen FiO2 will be 100%. So at this step you must be fulfilling these criteria to make it appropriate. Okay, so after that reassess. Suppose the heart rate is more than 60 beats per minute, well and good. Okay, so you have to discontinue this chest compression. You have given chest compression for at least 1 minute. The heart rate is now good, but that is more than 60. Discontinue this chest compression, but after discontinuing chest compression, continue that positive pressure ventilation. Remember, we talked earlier, that is breath 2-3, breath 2-3, squeeze 2-3, like that. So 40 to 60 per minute positive pressure ventilation, that should be given for at least 30 seconds after this. Okay, Suppose the heart rate is less than 60 even after doing 1 minute of this chest compression. So at this step, you have given positive pressure ventilation for 30 seconds, intubation plus chest compression for 60 seconds. Still the heart rate is less than 60 beats per minute. Now this becomes an indication for giving adrenaline to this baby. And adrenaline dilution should be 1:10,000. Remember, 1:10,000 dilution. Okay, that is raw adrenaline 1 ml plus 9 ml NS. That will make it 1:10,000. For 5 ml, take it in a 5 ml to be given in ET, and take it in a 1 ml syringe to be given in IV line or the IO line. That is IV access, or IO means intraosseous. Okay. So in the ET tube, the dose is 1 ml per kg. Suppose the baby is having 3 kg weight. It will be given 3 ml and without any NS plus. Just give via this tube. And also in the IV or umbilical line, that is, you are supposed to do umbilical catheter at this step. Via umbilical catheter, you have to give via, that is 0.2 ml per kg. Okay, suppose the weight is 3, it will be 0.6 ml with 3 ml NS plus. It will carry this adrenaline to the bloodstream very fast and it will act very fast. Okay, so the heart rate is less than 60 beats per minute. You have given adrenaline. Just after giving adrenaline, continue this chest compression ventilation. Okay, this 3:1 ratio for another 60 seconds. So when you are starting this chest compression, continue for at least 1 minute, that is 60 seconds. You can repeat this adrenaline for up to 3 times, 3 to 5 minutes interval. But still, if the heart rate is less than 60 seconds after giving 3 rounds of adrenaline, your DD becomes maybe 3 or 4. Okay, one is hypovolemic shock. Treatment is volume expander. Now you need to give NS 0.9% NaCl, and the dose is 10 ml per kg bolus, or could be tension pneumothorax, or maybe some malformations in the baby where you cannot do much. So still no response after giving this bolus, you can continue this resuscitation for up to 20 minutes, and after 20 minutes of adequate resuscitation, just ask the parent and just stop it. You are not able to save this baby. Okay, so this is a sad ending last. So if you are still watching me, you could have understood some things about this neonatal resuscitation program. So consider giving likes and also sharing with your friends, and please subscribe to my channel for more such videos and more such lectures in future. Thank you.